Welcome, everyone. My name is Brittany. I'm the training manager here with CADCA. And we're so excited for you to join us for March's Webinar Wednesday. We are here with Rick Collins, CADCA trainer and Coalition Development Support Extraordinaire, and Curtis Jameson, Grants Management Project Manager with the County of Maui Department of Housing and Human Concern. So thank you both for joining us today. Just a couple of quick housekeeping before we get started. We will be posting the recording of this webinar and slides to our Webinar Wednesday page, so you can share the recording afterwards with folks. You can access the slides and come back and view it, look at your notes, etc. We will be taking question and answers throughout, so make sure to use that Q&A box that's down at the bottom of your screen. We encourage that one over the chat so it doesn't get lost in the chat box, but we'll find it either way, don't worry. And at the end of this webinar, we will be sharing an evaluation link, and from that link, once you complete it, you'll be able to download your letter of participation for contact hours if you need them. You can only get those hours if you do attend the webinar live, so just be aware of that. And we are so excited to have you all with us today. Rick and Curtis, please take it away.
Great. Thank you, Brittany, and thanks for that introduction. Thanks, everyone, for joining us. If you haven't done so yet and you're so inclined, we'd love to see where you're calling in from. Many of you have been using the chat box for that feature. Yeah, tell us a little about yourself, where you're calling in from. We were talking about what our weather looks like, so if you feel so inclined to share that as well, please do. Little introductions for myself and Curtis. Well, just to let you know kind of where we're calling in from and a little bit of our background. So my name is Rick Collins. I'm a Cincinnati, Ohio native, but have lived out in Hawaii on the island of Maui and Oahu for about the past 19 years now, and got into this work about 10 years ago because I attended a CADCA boot camp by a famous trainer named Dave Chevelle and another fellow trainer that's no longer there, and got really interested in this work. I was in treatment prior to this, and I saw a lot of young people that were using substances pretty regularly by the time they were seeing me for mental health and treatment services. And the boot camp gave me a different perspective on how we might get upstream in our communities to look at how we change the environment, the landscape in which our young people have to grow up in, so that we can create a more protective, safe environment, that their choices they make can be healthy choices, that the default choices they make can be healthier choices. So I started on this journey, like I said, about 10 years ago. With Curtis and some other colleagues, started a coalition here locally right after coming out of boot camp. I was a coordinator for that coalition for a few years, and then moved into the director role. So I'm now the director of the Maui Coalition for Drug-Free Youth, and I'm the director for 2 other coalitions that we've started in the state, including a statewide alliance. So Curtis, I'll turn it over to you for some introduction.
Hi, everybody. So I'm Curtis Jameson. I'm with the County of Maui's Department of Housing and Human Concerns, the grants management, the program manager here. Our office, we actually fund, I don't know, probably about 100 or so grants in social services, some of which include prevention and treatment services for substance abuse. And prior to this, I used to do work, international community development work throughout the South Pacific and North Pacific, and got involved about, what is it, Rick, maybe 5-6 years ago or so. My boss came over and said, there's this coalition thing that we're doing, and you really, this is right up your alley. So she kind of asked me to get involved, and really enjoyed kind of getting in at the beginning of it and collaborating with Rick and some of the other partners in the community to kind of see what we can do to help with the prevention field. So it was a little bit of a learning curve in substance abuse prevention. I used to work in chronic disease, public health work before, but I really enjoy it, and really helpful to have somebody like Rick to collaborate with on this journey as we both kind of learned and grew through the process. And he asked me to kind of join him today, and I was more than happy to get involved. And my boss was like, "Oh, you definitely got to do it. This is going to be really good for you." So I'm glad to be here. And looking at the chat, there was someone from Hilo, and I just wanted to shout out to the guys from Hawaii that are on board. And sorry that you have all the thunderstorms in Hilo, but that kind of is Hilo. You guys get plenty of rain. So glad to be on.
Yeah, great. Thanks for being on, Sally, and thanks to everybody else. So today's topic that we're going to talk about is we're really going to take a deep dive into sector engagement here, and we're going to talk specifically about the local government sector. I have Curtis on, and Curtis, being from the government and as a county worker, what we really want to talk about is how we might look at how we engage government in a way that isn't just inviting them to show up at a meeting and leave once a month, but to really think about the meaningful role they can play in the work that we're doing, as well as how can we support, I think, the local government. How can we make that better? How can we improve the systems that are in place? So just a few learning objectives for today here. The first being, we'll talk about, how can we kind of effectively engage the government sector? We'll give you some different ideas that we think are helpful when considering recruitment to this sector and how we recruit to that sector. We'll also look at successes and pitfalls and kind of tips, if you will. This is mostly from Curtis's perspective, kind of being an insider, if you will, to how government works, to really think about what are some ways in which we can successfully engage with government, and what are some potential pitfalls that we might want to avoid and be aware of that from an outside perspective, we may not know that those are pitfalls. And so Curtis is going to talk to us a little bit about that. And really, we also want to leave you with making sure that you feel like you can take the next steps to engage or re-engage your government sector in the work that you're at, wherever you're at in your strategic prevention framework process. So just a quick chat box activity here, just to get our juices kind of flowing for today. On a scale of 1 to 5, where 1 is least engaged and 5 is most engaged, how engaged is your government sector in your coalition's work right now? Not black and white, where would you put them? This will be interesting to look at. They're flying in. So I see a lot of 3s, some 2s, some 4s. See a 5, that's great. A few 5s. All right, awesome. So we got kind of a mix. We got quite a bit of you kind of in the 1 to 2 range. We've got a few of you in the 4 to 5 range and some in the 3s. That's great. So what we'd like to do is ask you, if you are in that 4 to 5 range, even maybe a 3 range, and you have, as we're going through our presentation, you have ideas, suggestions, please feel free to use the chat box to provide resources, other ideas. So we really want this to be an opportunity, not just where we're talking at you, but where we can glean experience that's in the room and learn from each other. So as we're talking about, for example, assessment or initial engagement, if you feel like you have something that was really useful and helpful and effective in your coalition, feel free to put that in the chat box so that others can kind of be seeing some of that idea generation. If you're in the 1 to 2, that doesn't mean you're out of the equation at all. Even some of us who have minimal engagement have had some success in this, or in the past know of some successful strategies or ways in which maybe neighboring communities or our community has engaged the government sector in the past. So feel free to use the chat box for that. And as Brittany said, we're going to try our best to answer questions if they come in the Q&A box while we're talking. If we miss it, we're going to leave about 15 minutes at the end of today's presentation to make sure we can answer questions that you may have. So just to lay some foundation here and really briefly around this, because some of you I know are brand new to coalition work and some of you have been in it longer than Curtis and I combined. So we've got, I know, a lot of a range of experience in the room, but I just want to kind of lay a foundation and framework by which we're going to talk about coalition work today. And that is, these are kind of the key prevention principles, if you will, that we talk about in the Coalition Academy, if you've attended that. But I'm just going to briefly summarize them by saying that when we look at doing prevention in coalition work, we're taking a public health approach. And what that means is that we're including in our prevention work the environment in which the agent, in this case, it could be the substance use that's occurring in our community. We're considering how that environment plays an effect and impacts substance use in our community. So that's we want to make sure that when we're doing coalition work, we're not individually focused entirely. We want to be community level and environmentally focused. The continuum of care, we're usually falling in that universal prevention continuum there, where we're looking at community level, usually population level as our target or our focus population. That's usually what we're looking at. And so again, summarizing this in 1 to 2 sentences, this is going to be where we speak from, that we're engaging multiple sectors in our coalition work, that it's not staff driven. And part of this presentation today is to bring in an example of how you can engage a sector meaningfully in the work that you're doing. And again, that individual and environmental focused strategies, we want to make sure that we have a combination of those. And we certainly want to make sure that we are what we include environmental, because we get the greatest impact there in its population level, population wide. And the way that we do this is through the strategic prevention framework. Most of you have probably heard of this, some of you may not. We're going to touch really briefly on the strategic prevention framework, and we're going to walk through from assessment through evaluation how we've engaged the government sector. So we're not going to do a very what should I say? I'm not going to do much of an overview of this other than to say when we walk through this presentation, we're going to use this as a framework. I'm going to give you additional resources at the end if you've never heard of the strategic prevention framework or want to know more about it. But I will briefly touch upon what CADCA has is the skills and processes for each step in the strategic prevention framework. So the way that our presentation is set up is we're going to start with assessment. We'll briefly talk about some of the processes that usually occur in the assessment. We'll walk through how we did it and how we engage the government sector in that process. So Curtis, at this time, I'm going to turn it over to you.
Yeah, so I think one of the questions we really got to sort out is really why the government. For some of us, it may just because that's one of the 12 sectors that we're required to have. So you've reached out and to get the DFC funding, right? This is a requirement to have the 12 sectors on board, and they signed that forget what it's called, it's like a commitment form or something like that. But it's really important to know what you want to get out of it, right? And this is in reality with all the sectors you're involved in, right? What do they bring to the table and what do you bring to their table as well? So there's a lot of different reasons to engage the government, and a lot of governments often operate very differently. So even we have Sally on from Hilo, right? The county of Hawaii has a different setup and system than even the county of Maui. And I can imagine throughout the continental states there that government is set up quite differently, and your coalition may have different names. So what do you really want to get out of it? But some of the things the government does offer is, this is where the policy takes place, right? Eventually, a lot of you want to get into environmental change, we want to change policy, and policymakers are the government. So there's a big part there. Support, expertise, funding, organizational resources, and support can come in quite a few different ways. They could provide as well as resources, right? Meeting space. There's down there, it says fiscal sponsorship. Some of you may not necessarily be incorporated nonprofits and will operate through local government to be a fiscal nonprofit. Funding our local coalition before they receive funding from the state or funding from the DFC funding was actually funded directly through the county to kind of help get stuff up and running. And we were so happy to see that they got off of county funding at some point. So now the county doesn't fund them at all, and yet supports in other ways while they found other funding. And as the coalition looks to expand, they've applied for more funding, but the relationship is quite good that we've, at least through our office, have recommended them for continued and expansion funding. So it's a very resource-rich place to develop partnerships. And the government has their hands in all kinds of things and can make connections in a lot of different ways. And then data support. A lot of organizations within a government may have access to databases or systems. So like connecting with the police department to access records and some of their historical data regarding their operations and things that they see in the community through the community police officers and things like that. And that just highlights the fact that enforcement and government are quite interconnected. Even before this started, Rick and I and Brittany had a little conversation about what's going on with our new police chief here on Maui, right? And a lot of access and back and forth can happen between the different departments at the government and the police department. So, because in essence, law enforcement is a part of the government. So there are quite a few connections that can be made there. But again, it's really how you approach it and what you want to get out of it is going to dictate a lot of how and who you engage with and the different strategies you want to take as you move forward with engaging the government. And the next one here, what we're going to do is as we go through the day is we're going to take, not only is it just the engagement with the government sector, but we're going to do it in light of some of our experience here through the lens of how the coalition worked through the development of a social host ordinance. A little background on it is that this was the first real policy campaign that the coalition took on from start to finish. We got involved, we kind of cut our teeth on policy work when our liquor commission decided to pass 24-hour liquor sale. But we kind of rode the coattails of other folks, but learned the impact it has when you change policy. We eventually got that repealed and so there's no longer that policy in place, but we then moved on to social host, and this became from start to finish, from idea to passing of the law and now working regarding implementation and evaluation. It's the first local social host ordinance in Hawaii. There was a criminal one statewide, but this was something that was completely unenforced by law enforcement. And we felt that a local host would have more impact on the community. And it took us about 3 years to pass it, and we passed it in the middle of the COVID pandemic. And some of you know Hawaii, we're very conservative, our nature of our community, and we've been very conservative. And with our approach to COVID, we're the last state to look at dropping indoor mask mandates. Our infrastructure and community and hospitals really need a lot of protection. So COVID had a lot of impact on our community. And yet we were still able to, it did put some delays, and the changing police chief is one of those bumps along the road, but it took us about 3 years to get this done. And we'll look at this as we go through the SPF and the different phases of the SPF in light of the social host, and then what role the government kind of played in that engagement. And maybe the first thing that we want to kind of talk to is this idea of really the engagement. You kind of got to get good buy-in in it, and lasting buy-in comes from a person more than just a position. And in this way, it's kind of, in some ways, the coalition kind of got lucky that I started working for the county, because I'm a permanent position. I'm not an elected official. I'm not an appointed official. And I really like public health work. I see the value. I like working with youth. I did years of international community development work with youth. And that's why my boss came and found me, and Rick and the other guys of the coalition did quite a bit of engagement with me individually to continue to get that buy-in. So you really want to look for that person that finds the work interesting. And then that person to have access to other parts, right? Because you can use their connection to policymakers or administrators or department directors, people who actually can assist with making change and carry a little more clout than some of us just regular, I don't know, we like to call ourselves the grunt workers, right? We get the stuff done, but have access to those that have much more authority. Lawmakers, you're going to end up engaging them, and to have a process to ensure that the decision makers are at some level involved in the coalition. We've had some buy-in, and there's different champions we found at the county council that assisted with moving forward some of our policy and providing insight into the process. To do this, the one-on-one is important. Rick and I actually built a lot of our relationship. He started getting me to come to CADCA National Forum, and we went to the National Prevention Network stuff, and then locally things here. But also through individual meetings and just time spent together. And that really helps build that rapport.
Did I ever take you out to food?
No, you never took me out to food, but we went to take other
Dang.
people out to food.
Yeah, dang, I feel
We-
so bad. All right,
You,
well,
you and I started doing lunches with other people, but that's,
I always say food is the way to loosen folks up and get to their heart and have them in a good space so you can get the yes that you look for. Sorry I didn't do that with you, Curtis. You must have been so excited that I felt like you were already there. But
But
yes. Anyway,
food
sorry,
is
Curtis.
important. And I think what it highlights is that the informal is just as important as the formal, right?
Yeah.
The formal meeting space is a good place. That's where you get some of this direct conversation and consultation. But there's so much space around it for informal, to sit down with somebody and talk story with them before or after meetings, on the side, make yourself available, or create a space where you can take them to have a conversation, like over a meal or coffee or things like that. In Hawaii, the neighbor islands, we end up traveling back and forth quite a bit to the city where the state government is focused on Oahu. So at the airport, I don't know how many times Rick likes to show up right before the plane leaves, but you spend the whole plane together, you spend trying to get your transportation together. Those informal spaces are important. So you really want to capitalize on that to build a relationship. Because as much as it's money and policy, relationship is what lubes the whole thing, right? This is the thing that gets, you want to cut through red tape at the government, you got to have somebody who can help you move through that process.
Yeah, that's really good, Curtis. I've heard it said the real work happens not inside the meeting, outside the meeting. And by that, it's exactly what you're talking about. That, and this slide's a terrible slide because it has too many words on it. But I think what we were trying to emphasize and re-emphasize and drill in here is that you want to build relationship. It's a relationship. It's understanding. You want to have consensus. You want to be really clear on expectations. You want to know what their buy-in is to this. That basically what we're suggesting you avoid is that you just identify who in the county is in the some position that makes the most sense, and we'll just invite them to our meeting. We don't want to. That's not going to be an effective way to engage that person. Curtis is a grant manager. Before this, he was in immigrant services. So the connection there was really loose. But what we knew about Curtis is he had a public health background, that when we talked to him, he said, this stuff is really interesting, that his boss supported it. So all of that lined up. And even though he was doing immigration services, and I'm sure you could make a tie to that in some respects, he was doing it because he wanted to do it. So we got the engagement from Curtis because he was excited to do it.
Yeah, and I think just one more of those last 2 points are important. One is you have to realize government is a hierarchy. So I have a boss, and I've changed bosses as the mayor changed, the administrators changed, and my directors changed. So you really want to make sure not that relationship builds through into that hierarchy, so that, like I said at the beginning, my boss is excited because my boss has buy-in on this, and we spend time making sure that the people that surround me and help me make decisions are also bought into this process, and it's an important part. And then specific tasks. Rick, I've been on a couple of different committees at the coalition, and that I think helps solidify not only the relationship, but the role as well with things. So
it's Stephanie in the chat box. Thanks for that question, Stephanie. What do you mean about the last points, specific tasks, not meetings? So the mantra that we like to follow is don't recruit to meetings, recruit to tasks. And so Curtis, I don't know how long it's been since you've actually been to a general meeting. It's been months. But if I ask Curtis to do a specific thing like, Curtis, can you talk, this is an actual example. Curtis, can you talk to your director? We have a county council member who's on the fence about the social host ordinance. Can you schedule a meeting that we meet with your director? Let's get her on board. Let's get her to a place where she's got a good relationship with this other county council member, so she can pull it over the line for us and get his support. So it's those kind of things, as opposed to telling Curtis, can you show up once a month to a general coalition meeting every month? He's too busy for that sometimes. So what we're doing is thinking about those specific tasks that he can help with. Does that work for you, Curtis? Anything else you want to add there?
Yeah, I mean, I was recruited to, when the coalition was trying to get DFC funding, they recruited me to help with some of the review of the application that was going in. So even doesn't have to be specific to a line item, but even with the social host, before we did those, I was on the committee. I was asked to assist because of my background with data and things like that, to assist with the issue brief, right, where we kind of collated some of these data, and I worked with a couple other individuals. So there's very specific things that I was asked to assist with and got involved with. And that's what it is. I try to go to the meetings, and there's a value in the meetings to get that general consensus and understanding. But really, if it's just a meeting, there's too many things to do for me to just sit in a meeting where people talk at each other for an hour or two. People want to get stuff done, and they want to feel like their time is well spent and worthwhile.
So I think that's what we mean. That doesn't mean you never tell people to come to your coalition meeting. It's just that you think about, and particularly with government folks, they tend to be really what we call grass tops folks. They're involved. Curtis is not just involved in coalition prevention. Curtis oversees 75 or something, I don't know how many, is that close, programs for the county. He's got his hands in a lot of stuff. So his time is limited. How can we utilize Curtis in a way that he feels like he's contributing and he feels like he's in a meaningful role, right? And that's gonna keep him coming back if he's feeling that way, as opposed to simply generally saying, just show up to this meeting, show up next month to a meeting, and he feels like maybe he doesn't have time for that. All right, so we're gonna spend the rest of our time here that we have presenting, looking specifically at how we utilize the strategic prevention framework. We're going to talk about the process by which we did this to implement a social host ordinance. So we're going to give some really basic, at each step, we're going to give some really basic processes about what those steps look like for those of you maybe unfamiliar with the strategic prevention framework. Then we're going to overlay how we did it with the social host ordinance, what those activities and processes were with the social host ordinance. And then Curtis is going to talk about his involvement in each of these steps as a government sector representative. That's how kind of the flow of this will go. And like Stephanie did, thanks for breaking the ice, Stephanie, with the questions. If you have questions, please, you can use the Q&A box there on your toolbar, or we'll do our best to see them in the chat box, and we'll answer them as good as much as we can as we're moving along. So in the strategic prevention framework, this again is a process, and it's an evidence-based process by which we can do our prevention planning and implementation and evaluation of our strategies. We always start with assessment because we want to be data-driven. We want to know what the issue looks like in our community, what the risk factors and protective factors are that are contributing to substance use in our community. And that's going to be important that we start there. And so some of the processes in community assessment from a coalition perspective include these 5 here. So we're going to define and describe who our community is. We're going to be collecting lots of data to look at what's the need in our community, what are some of the resources in our community, what are resource gaps in our community. We're going to conduct what's called a problem analysis. For those that have been through the Coalition Academy, you'll know what this is, but essentially we're looking at why is this happening here, what's contributing to substance use in our community. That helps us identify really specific behaviors that are unique to our community. We're going to develop a logic model based on that, and we're going to update our assessment as needed. We're going to come back to this so that it's not a kind of one and done assessment. We're going to want to continue to come back and assess our community based on, what are the current substance use issues. And as many of you know, these change over time. And so we always want to be kind of looking at that and making sure we're assessing our community. So this is what we did when we were going through the social host ordinance kind of phase. And we didn't know yet, when we were collecting data, one of the things that popped up to us is we recognized that over 50% of young people said that the most high risk setting where drinking was occurring in our community was in home parties and graduation parties. So we did over 400 youth surveys to identify that. Now, it wasn't a sample size, but we thought it was compelling enough for our smaller community to make a case that, okay, there's a trend happening here in what young people are reporting in terms of the highest risk setting in our community, the most common setting in our community. We surveyed some adults and we found that over 90% of parents, I know it was probably close to 95% of parents, didn't want their kids drinking other people's houses. So we began to debunk the kind of myth that parents don't want to be told what to do with their kids. It wasn't about that. It's that parents didn't want their kids drinking at strangers' homes or at other people's houses. That was beginning to tell us the story of our community, the attitudes of our parents, and began to tell a compelling case of why we needed to do something about the house parties. We did lots of listening sessions. So you can see, of course, we pulled in we have YRBS, which is the Youth Risk Behavior Survey. Some of you have Pride Survey in your states. We definitely pulled that in, but that doesn't tell you the story of your community. So you got to get down and dirty, right? You got to do listening sessions with young people. We did listening sessions with law enforcement. You got to do key informant interviews with people in treatment, stakeholders, youth serving organizations, community groups, neighborhood associations. And we did some informal surveys, as you can tell, of young people and adults. And this was the picture that was being painted. So what the data began to tell us is house parties are the most commonplace. We found out through qualitative data collection, like listening sessions, that there was a lot of consequences happening at these parties that was going unreported. And we found out that parents didn't want their kids drinking in other people's houses, and that the police were saying, yes, it's happening, and we don't have a tool to deal with it. So Curtis is going to talk a little about how he, as the government sector, kind of engaged in the assessment process.
Yeah, so through this, and it, to be honest, a little bit of it wasn't just at the county level, but a lot of it was helping the coalition, because this is the area where we're collecting data, right? We want to get a sense of what's going on and read the reality of our local community regarding this issue. And connections were important. And this was something that we helped with. Our county has connections with all of the youth centers and a lot of the youth serving organizations because we fund them. And so we have this relationship. And as the coalition was identifying where they need information from, we would try to connect them with people in that community or in that area that would have access to, say, youth, so they could do their youth survey. And we would try to do connections like that. Our coalition's quite strong. I would say it's even stronger in youth serving organizations. This was kind of the target group that helped really form the coalition. So there's a lot of buy-in from them, but they only represent parts of our island. And Maui County actually encompasses 3 islands. We have Molokai and Lanai. So how do we connect on those other islands when most of the people just operate on Maui itself? But also connections with different government departments, right? So like the Parks Department for information, schools, and to make those connections between the schools, and some archival data. And this was a little bit maybe more at the state level, where you can have access to things like the YRBS and some of these surveillance level data collection tools that then could be used to also make the case, right? To bring it down from that large, what you call it, like the 30,000 foot level down to the grassroots, right? Down to the community level. To make our case a very clear case. Not only is it Hawaii has a drinking problem with underage individuals, but Maui has an even worse problem than most of the county, right? We have even worse statistics than the rest of the state. And then the idea of getting buy-in with things, and this was something that was important, was getting people to listen to the youth, to actually hear, and listening sessions, and to be able to assist in the development, so that there's also not just quantitative data, but qualitative data coming through to assist with that informing. The little thing there about Zoom meetings are coming is that we can't just rely on things to happen in the formal setting. We have to move a little bit out of that, and to get out of this sense that we have to just meet with folks, right? So a lot of this was actually done individually and by making connections. I didn't make any of the connections for the coalition to the police department, but my previous deputy director had a lot of those connections. She was a previous school teacher, so she helped understand the school system, if not make some assistance there. So there's a lot of different ways that these connections happen, and it's not just through the formal setting.
Yeah, thanks, Curtis. 2 points I want to make to kind of piggyback on what you said there, Curtis. That first one around connecting the coalition to key informants and stakeholders in the community. Yes, government is great for that because they have all these connections. So Curtis, like I said, oversees 75 programs in our county. He knows all those people, right? So that's one thing. And he's a funder. That's like the double punch, right? So if your funder comes and says, hey, can you help this group over here, they're paying, they're paying for your lunch today. Yes, of course they're going to say yes, right? As opposed to me, I have no relationship with them. I don't fund them. I might not get the same response that Curtis is going to get because he is the funder. He's got relationships with these folks. So Curtis can do some really targeted outreach in a way that it's not requiring him to sit in long Zoom meetings where he's idly standing by. We're saying, okay, we need these 5 connections. Can you help us? Can you do a warm handoff on those or whatever, something like that, right? And that last piece around involving them. So Curtis is probably not going to go out and do surveys because he's too busy for that. But one thing that you can do to involve them in the process is have them sit in on like a listening session. It's really powerful when you're in a listening session with young people and they're telling you about the consequences that they know their friends have had because of, let's say, house parties or whatever that local condition is that's happening in your community. It just begins to put the story together where it's no longer just data. And it hooks people into it. So all of a sudden now they're way more committed to this because, oh my gosh, we have to do something about this. I was just sat in this listening session and was floored by what young people are telling me, right? So maybe it's not that they're out doing that, but you're inviting them to 1 or 2 listening sessions. Could you come sit in this for an hour? Because I think it's really important for you to hear some of the data we're collecting. They're going to be more engaged in that. They're going to be more ready to do the next steps because they're seeing it firsthand. I have a question in Q&A. Is listening session a focus group? They're a little different. Listening sessions are a bit less formal. They're a little more open-ended questions, and you allow the participants a little bit more to take the conversation where they want. Focus groups tend to be a little bit more structured, but there's plenty of literature out there that to talk about those. We did a listening session format where we basically generated a few questions we wanted to make sure we hit, but let them do most of the talking and take it in the direction they want it to go. But there's plenty of stuff you could look up, how to facilitate focus groups or listening sessions, and that you'll find a lot of information out there. So now we're moving into step 2. So we did our assessment. We identified our local condition of young people being able to access and drink alcohol at home parties that were often unsupervised, or graduation parties where adults permitted that to occur as a kind of a a rite of passage or something like that. So now what we're moving in is capacity building, and we're saying to ourselves, okay, who needs to be involved? And again, I'm kind of looking at, very brief overview of this. Do we have kind of a process and structure in place by which we can begin to think about and build capacity to implement prevention strategies, particularly a policy strategy? Are we beginning to develop leadership, ownership in our coalition? And are we providing training opportunities so that our coalition members are informed about the policy strategies and informed in ways in terms of how we're going to implement a social host ordinance? So some of the things that we did as a coalition is we developed a media plan. We actually had a media training with a very kind of expert person in the field on media advocacy specifically. So not just media awareness, but media advocacy. But we also did some media out there to build awareness. You want to make sure that the community knows about the problem before you're proposing a solution. So we did some training around this and began to try to develop a media plan to say, we want to make sure folks know about this local condition before we say a social host ordinance is going to be a solution. Because if you put the solution before people know about the problem, they're not going to make the connection. We provided a number of training opportunities. As I'm probably going to steal Curtis's thunder, the county paid for a lot of this. The county actually supported a lot of this. We looked at how do we begin to engage more stakeholders in this specifically, who are going to be involved in the social host ordinance implementation, and how do we begin to develop leadership internally to own the process so that it's not all staff driven. So here are just some, so I think I want to say one thing about, I guess I don't need to go back there. I want to just say one thing. I'm showing print media because I think a lot of us do social media pretty well. But it's only one platform. And I think what I wanted to show here is print media is really important when you're doing policy work, because as policymakers definitely still look at social media, but they are also ones that still look at print media. So I just wanted to, but print media is harder to do than social media. So I just wanted to tell you, we're not very special and we still did some print media. So go out there and make sure if you're beginning to pass a policy, you're thinking about all those different mediums by which you can be presenting the issue in your community. So I just wanted to give a few examples here. We have an op-ed. We have, this is a great one. This is Curtis's former supervisor who he was talking about, the deputy director. We actually got her to author a piece for our newspaper about, we're talking about COVID-19, and we're simply raising the awareness of the community on the problem of alcohol in our community before we're going to a social host ordinance. So again, we're in the capacity building phase here. So we're building readiness of our community to begin to address and deal with the problem. But we knew she's a prominent person in the community. The newspaper would love to pick her up because she probably knows the person anyway. She probably knows the editor, and she's a prominent figure, and she's willing to put herself forward about this and get some attention in the media and in the public. We developed a training plan, as I kind of mentioned. Here are just some, I'll run quickly through this, but here are just some examples of what we did and things to think about. So trainings like education versus lobbying, everyone's going to have questions about that. Clarifying at the front end, who can lobby? We knew, and if you're going to pass any policy that's got a decision maker who's been voted into the position, making a decision or developing a policy, someone is going to have to lobby. Someone is going to have to tell decision makers, you need to pass this because it's best for our community. So you want to clarify that up front. So we began to work on that here in the capacity building phase. Again, this is about building the structure of your community to be effective at this as you begin an implementation phase of passing a policy. We did lots of different trainings. We did policy trainings. We did to know the policy. We did community organizing trainings, the media advocacy training I talked about. We did youth trainings to begin to develop our youth coalition in terms of how to speak up about this and how to be involved and become youth advocates.
Yeah, I think that was one of the things with this is that idea of being strategic and being approaching things. So that one about lobbying versus advocacy. As a government person, I can't lobby really my own government. And some of the things we'd go to were paid from federal funds. So, but the ability to advocate for things and to know the difference was a training we did. And like Rick said, and I think on this slide somewhere, the idea of training to shift the coalition work towards policy development and to use funding. And we did use funding. It was I don't know if we used county funding. We definitely used some other funding that we received as a grant. So it was beneficial for us because we were able to meet our requirements for a state grant by providing training for the coalition for their work. So it was, in that sense, was mutually beneficial because our program that we were responsible to the state for looked better, and we were able to report good outcomes as we provided training for the coalition, and we were able to leverage. So it wasn't even county money we were spending, but there was sometimes we would spend county money. But a lot of connections, the youth centers was one that there wasn't a lot of engagement. I think we have 5 independently funded youth centers, and then the Boys and Girls Clubs has 5 or 6 clubhouses, and we fund all of them, but we only had 1 at the table. So be able to connect the coalition with the rest of those gets a much more spread and diverse engagement with the community. Key local government leaders attended national and local trainings and conferences. And this is something that Rick and I have both kind of made sure happens, because if I want to continue my work, my boss has to be on board. And I've approached her multiple times to make sure that in her calendar, and she's the director of a big department. So you may know one of the major concerns on Maui, as much as a lot of Hawaii, is our housing. Our housing costs has just gone through the roof, and we're the Department of Housing and Human Concerns. So human concerns during COVID and housing shortages means my boss is super busy. But we made sure on her calendar was some time to get her acquainted with the work that we're doing so that she can continue to allow us to support it. And even though the print media Rick had was my previous deputy director, we've also had the director provide testimony for the social host written testimony and be able to support it and have sessions with her where she would give advice on how to approach that. So making sure that they're engaged and informed and on board was part of what we made sure happened. They developed organizational partnerships to support the policy, and this was allowed through law enforcement and community organizations. And then as Rick kind of highlighted and shared that idea of media stories and getting involved in informing it and providing information in that on topic. And if you get your director or a department to kind of weigh in on something, it carries a little bit much more push than if even though we, like our department, our division, we do, Rick saying 75, we actually probably have about 104, 105 grants right now to different social services. And we do about, I don't know, about $13 million in funding to it. So we are quite busy. But even through that, Rick was saying that we might have gone to listening sessions, but now that there's so much investment and interest and involvement, I've actually been able to assign staff to do some of that work on the assessment side. So this last time when they're doing interviews, I had one of my program specialists assist with the interviews, and she helped conduct some of those for our next one, right? We did social host, DFC communities. You got to do two drugs. Rick, tell me if I get this wrong, but 2 drugs. And then, so the next one, we're starting to try to figure out what steps we're going to take on our next work. And we're in that assessment phase and capacity development phase. And so I've assigned staff to assist with that, even though I may not necessarily be involved.
Yeah, great point. Great points, Curtis. Don't be afraid of the word lobby too. You just can't do it with federal funds.
Yeah.
You can find unrestricted funds to do this, and you'll be surprised. People will put themselves out there to help you with that, just like Curtis's director went and testified in support of that, of the social host ordinance. So don't be afraid of it. Just know that it's a challenge that you can overcome. I'm actually a registered lobbyist for our county. So, you can be a registered lobbyist and a drug-free community director or coordinator. When you are lobbying, which is usually not a lot of time, you just have to have an unrestricted item to do that.
And know who those guys are, identify them specifically, and ask, can this be a role that you play?
Yeah.
Right.
Yeah.
I can't do it. Can you can be part of this team, the coalition, who can do that? And you identify them, and then you help make sure that they have the knowledge, the skills, and the ability to actually go out and carry that out. They may need a little bit of accompaniment. Somebody may have to help them the first times, but it's an important part. So you want to make sure you identify it. The other side, they definitely doing it, right? We know the alcohol guys got their lobbyists all over the place. So
for sure. Thanks, Curtis. So just moving now into the planning phase. And the planning phase is where you're moving now from you know the issue in your community, you know the local conditions, you've developed a logic model. Now what you're doing, you built the capacity, you're building readiness in your community to address the issue, you're building the capacity internally of your coalition to begin to have structures in place and training and help make sure your members are informed. Now what you're doing is you're beginning to create your action planning, and you're developing your strategies and what we're going to do about this with each of those substances and around each of those local conditions. So for our planning phase, we did a few things that I think were key and important. And one is that we looked at what were going to be the policy options that we could do around our local condition of young people drinking in homes and accessing alcohol in homes, and graduation parties where young people are drinking and nothing being done about that, right? So we began to look at various options. We landed on the social host option, but we took time to make sure everyone was informed about policy options we could do and make the decision to say, yes, we're going to do that. We did that by obtaining consensus. So we did not vote on it. We simply spent probably about 2 to 3 months having one-on-one meetings with folks to say, what are your initial thoughts about this ordinance? What questions do you have? What hesitations do you have? Is there anything that's scary to you? Is there anything that's exciting to you? Because if you don't ask that now, it's going to sneak up later. So you might as well talk about it and not slam this thing through and not have everybody on board, because when things get tough, people aren't going to own it. So you want to make sure you spend time, garnering that support, informing folks on what it is and getting consensus. The other thing we did is we created a policy action statement. So those that have been in the Coalition Academy, we used the 10 policy action steps. That first step is to create what's called a policy action statement that looks at, well, what's the problem and the policy solution that's going to solve the problem, who's going to benefit from it, who's going to pass it. And there's one more thing I can't think of, but what it does is it sets an ad hoc mission statement for your group to say, anybody that's coming in from now on, we're going to be really laser focused on what we're focused on. And we're focused on reducing house parties by passing a social host ordinance and having the county do that. And we're going to see this benefit in our community because of that. And the last thing we did that's probably obvious is we developed an action plan that helped us look at what are the steps we're going to need to pass this ordinance.
As part of this process with the engagement, in that planning process, and I think that this is where it was really helpful, because through the government we were able to, through our connections and our process, but also identify and answer these questions and hesitations, but also with our knowledge of policymakers, since that's where we were going, was to identify who might be the people to work with at that policy level, which council members we might be able to go through, and who has access to those council members, and then help the coalition decide, because for some of them, we were very specific as to who was going to visit that council member, right? And this is part of that planning process, and getting into that, these one-on-ones and answering these specific questions. What hesitations do we have? What does the department, what is our stance on things and where are we going with things? Through planning, providing space and meetings for trainings, we've had a plethora of spaces, but I know one, we actually just did the coalition meetings at a government office for the longest time, and it wasn't even in our department, but we were able to make connections. The coalition was then able to function through another element of the government to get those spaces. Onboarding organizational partners, again, bringing on board the people who and the programs that need to come. But that connection to government departments and commissions was probably in the planning phase. One of the key parts to it is to help. How are you going to navigate policy change? Who needs to be on board? How do you approach them? And what might be a strategy to get there?
Great, thanks, Curtis. The most important part on this slide is, are you wearing the same shirt, Curtis? Sorry, I couldn't help myself. There's Curtis there.
No, I think it's a different one.
Okay. All right.
Although I only got 4 Aloha shirts, I just rotate them home.
So then maybe you don't need a meal. I gotta buy you a shirt. That's the just kidding. Sorry. You can tell we like each other. That means I like Curtis. All right. So moving on to implementation. So now we've decided what we're gonna do. We're gonna pass this social host ordinance in our community. It's gonna benefit our young people and our community in general. And it's gonna be, we're gonna increase the health of our community. We're gonna engage our law enforcement in this, and we're gonna get moving on it. So here are some of the activities and the processes you would be doing in that implementation phase with any policy. You're going to be looking at prioritizing those strategies in your action plan. You're going to develop that action plan. You're going to get ready to implement it. You're going to continue to obtain resources. I almost think they need capacity there in the center of the SPF, because you're always in a way building capacity within each of those phases. So you're going to be looking at what additional resources do you need. We got connected to people in this phase, for example, through the government folks like our prosecuting attorney's office, because we had to figure out what a civil social host looks like as opposed to a criminal social host, and making sure that we're following best practice. So they were able to link us up easily to those folks because they work with these people all the time, right? We had to begin to talk to county council members about this. They linked us up with that. Taking your slide, Chris. So we're implementing our action plan, and we're ensuring that we're coming back to that action plan often to make sure that we're following it as much as we can and updating it as we need to. We certainly, as Curtis said in the beginning, we hit roadblocks. The pandemic was a major roadblock, and it backed up issues that were priority that the county council had to deal with prior to dealing with the social host ordinance. But we also made noise in the media to say, hey, everybody, we can't simply put the brakes on this because drinking is going up. Young people are continuing to drink in our community, and consequences are continuing to happen. So some of the implementation, kind of key implementation processes that we did for our social host ordinance is we created an issue brief, and Curtis can talk a little bit more about this, that really maps out what your policy is going to do and how it's going to improve the community. We looked at, we began to meet with town council members, or here they're called county council members because we're county, we're divided as a county. But we began to meet with those folks, began to tell them about our policy, why it's needed, began to garner their support. We drafted policy language, so we came into the public sphere with a best kind of, this is our best policy we could have forward. And that, of course, started back in the capacity building phase, where we're doing trainings and ensuring that we knew what those best practices were. We organized community support. We began to do media advocacy work to influence the decision makers, and we passed the policy in this phase.
Yeah, so in our experience, right, again, this is, and there may be other experiences as well that a lot of folks have had. But in our experience, when we were going through this phase, I would say once you get into the implementation of policy, this is a lot of government work, right? Because you need the council members, the lawmakers, the policymakers to actually pass policy, and you need one that works. So the government sector probably got quite a bit involved in this phase. Some of the points here talking to the integral in drafting the policy language, the attorneys kind of drafted up the first time. That's the way our county works, right? Eventually ends with corporation council, and they take a look at law and this and that and draft all of the language. But in that process, even there, I should say they draft the first official, but we provided them, the coalition provided them with that first draft as to what we wanted to look at it. And we knew going into it where our cutoffs were, right? If this is taken out of the policy, then the whole thing is dead. We're not going to move forward or support it. And we made sure that everybody was on board with some of those things. So this is where we had give and we could negotiate or compromise, but there were certain items that we could not, right? Like one of them being that it was needed to maintain needed to be a civil social host. It couldn't become a criminal because there already was criminal and that one wasn't being enforced. So there were certain elements that we needed. The other one was informed, right? Are the members or the homeowners need to, what is it, Rick? They have to be informed that this is going on, right? So that they have knowledge of the party and therefore they could be held accountable. And we wanted to make sure that that wasn't a part of it so that they could still be held accountable. They kind of come downstairs and said, I had no clue there was a party going on and therefore everything is gone. We wanted to make sure that wasn't there so that the police officer could still issue that citation or that enforce the policy. So there are things that we talked about in the policy and what that looks like, and reviewing it was really a part of corporation council. And if the director and people are on board, then it goes through. And even at the access to the policy makers, how do you approach them? Who do you approach? Who can champion it? Which committee at the government is the best one to introduce it at? And our director assisted in understanding which ones and how do you approach them, right? Even to the point where it's like, if you're going to visit these guys, you got to have local people. He doesn't listen to people from the mainland very well. So you make sure they're local people that come and approach him. And this other one is, if you're going to come in at this angle, you really got to come in as this is about protecting children and holding children accountable. One thing, like with the mayor, getting support for the mayor, our first discussions with the mayor, he was so supportive of it, but his whole angle on it was holding the kids accountable. And he wanted to punish the kids for underage drinking, which is sometimes we run into that perceived norm that this is where the problem lies. But the social host policy is all about holding adults accountable for minors, right? We don't let them drive. We don't let them, do all these other things that we consider work. We still consider them minors and they need a guardian. Yet we're going to hold them accountable for their actions when in other realms, we don't even feel that they're old enough to be accountable. So helping to change the mayor's point of view on that was part of that process. I'm not sure we got all the way through it, but we got enough that when the policy came through, he would sign off on it. We did other things too with involvement in that. Part of it was the development. This is a piece of our issue brief and some of the data that was on. I was on one of those, they call the ad hoc committee, but we helped put that together and bring things. And then at the end was testifying. We got the director. I think that was a big piece of support when you have the department backing it up. And even internally was the discussion with my director, who's the best to submit that, and kind of convincing her, it'd probably be best if you submit it, and then I'll stay out of it. You do that work. And that's what she did. I see a couple questions in the chat. One about how to engage government folks, but I'm thinking maybe just with the time of where we are, you can keep putting them in the chat, but I don't know, Rick, maybe we can get to them at the end.
That sounds good.
Get through the material.
Yeah, that sounds good. That sounds good. And just, I want to highlight what Curtis said there, this second piece around, they can help you navigate before you, and as you're developing your policy, they can help you figure out those government systems. Like if you're going to have an administrative hearing process, which means anybody can appeal it, you got to have that. Where's that best fit? So you can have all this kind of figured out, at least the best case scenario, because what you don't want to do is lose the policy. You don't want to just turn it over to an attorney at the county and say, here, can you draft this for us? Because it might not be the best fit. So we're leveraging their know-how inside the government to figure this out, along with other things. They're just, we're dynamite. We're awesome. That's all I'm going to say. So evaluation. When we're evaluating our coalition's efforts here in the evaluation step or phase of our strategic prevention framework, there's kind of 4 key processes we're going to look at. We're going to look at confirming baseline data we have on our logic model that we started with in the assessment. We want to make sure that we're documenting our coalition's work as we're going along. We want to be able to tell the coalition's story. So we don't want this to be something that no one knows about, right? We want to make sure we're out in the community, making sure folks know about this change that's occurring, making sure they know a year or 2 down the road, how has this ordinance and policy, how has it changed behavior? How has it improved the lives of young people in our community? And we want to develop a data collection plan to help us do that, because we're going to be wanting to continue to collect data to show the impact of our efforts. So some of the key steps, and we're kind of in this right now, actually, because we just passed the policy the policy went into effect in September of this year. And we're kind of still in this phase of working with our evaluator on some of this. But what we want to do is we've got our baseline data. We have that. That was what we had in our assessment. We're in the process of creating a system within law enforcement to make sure that when they are showing up at a house party, that it's documented in a way that we can track those over time. Usually are not going to be, most departments are not going to have that set up. So you have to work on that with your law enforcement folks. If you're doing a social host ordinance, or for that matter, kind of any policy, you want to make sure you can have a tracking system in place. You want to have an internal kind of evaluation plan and data collection plan internally within your coalition, so that you're making sure you're collecting data over time. It's going to show results of your strategy and of your efforts, and you want to make sure you share those with the community.
Yeah, so as Rick said, we're kind of right at the beginning of this phase. So we're in the thick of learning about it. But one of the things that again, it's about a lot of connections, our department with the police department, but this idea of ensuring that there's access to that police department's data, right? Because if the community police officers are out there, how many calls do they respond to, and how many citations get issued, and those at that level. So to ensuring that there's access to the data so it can be assessed and evaluated. Currently developing new internal processes to assess and evaluate prevention services, and leveraging the relationships with key partners who can assist in collecting data. Through this process, and maybe we'll talk a little bit about it in sustainability, is how this process has informed how we organize ourselves in our department and the funds. Because we do about about $4 million, about, I don't know, 20 some youth serving and prevention and treatment programs that we fund. And how do we organize that so that there's some continuity in the work that we do? I don't like wasting my time and having things siloed and unintegrated don't help with things. So how do we integrate it? And that has been something that we've internally done just by going through this process. But how do we reflect that back out through to the coalition? And I think that as we go through this process, seeing how that goes, can we learn from it? And as we're learning and evaluating this, to take that and then use it in the next phase, right? Because the whole purpose of evaluating is to continue your cycle moving forward. What we've learned can then impact what we do next, and not just at the coalition level, but we have an interest in it ourselves, into how as a department we're going to use that data, use that information to assist us with our decisions regarding funding, programming, how we organize ourselves. Two things, Rick. You shared the issue brief, but it was only to the panelists and host. Maybe share to everybody.
Oh, shucks.
And then,
didn't mean to do that. Okay.
Yeah.
Thanks for that.
And then LTE. What does LTE stand for? That could be a quick one we can put.
Yeah, so LTE is called letters to the editor. So it's those opinions, it's in the opinion section of your newspaper, and it's ways in which lawmakers usually look at these because they want to know what community members are talking about. It's a way to use the media to show that your community is interested in the issue and that your community wants the issue to, or the policy in this case, to be implemented. So it's a way to influence those decision makers. Thanks for that question, Curtis. And I'm going to move on and get us through some more of this. So now in the middle of the strategic prevention framework are these two principles that we want to integrate throughout the process. We're not going to give that a good due justice here, but we're just going to briefly talk about some of the things we did around cultural competence and sustainability. So when the processes by which we want to think about cultural competency and some of those skills that we're going to be developing throughout our strategic prevention framework, because we want to make sure we have from the beginning that we think about making sure we're culturally relevant, that we're culturally responsive, that we're integrating that into the process by which we're doing everything. We want to make sure we identify communities within communities in our community. We want to make sure that we are looking at what are the subpopulations in our community. We want to make sure that we're recruiting members of the population of focus, and that we are representative of our community in our coalition from an ethnic, racial, geographical perspective. Some of the key pieces for the social host ordinance in this was really looking at, we looked at the equity of the policy. And so one of the things we wanted to think about was, is this going to harm any groups? And how do we make sure that this isn't inadvertently harmful? So we looked at things like, well, what if folks can't afford a fine? What could we do? So we included a community service option in our original version. We looked at an appeals process if people felt it was unfair. And we also are going to collect data about the individuals that are cited, because we want to look at trends and we want to make sure that it's being enforced fairly, and that there aren't certain populations or groups or communities that are being targeted only with this ordinance. So we're going to have to work really closely and in step with law enforcement to do this, but we're beginning to have a process in place for that. And there's some other things, obviously, too, developing leadership with individuals, starting with assessment, who are part of, that are representative of your population. If you're dealing with youth, if you're dealing with a subpopulation or group in your community, making sure that those people are represented.
Yeah, so with that one, I think one of the things we got involved with, and this is kind of when we were talking about planning and implementation, was this idea of having a strategy. And there's a lot of conversations that Rick and I, and even the core leadership of the coalition have gone through. It's not just who's the first people involved, where there's Rick and the current coalition coordinator and things like that are receiving training, but how do you get to that next level and the next level behind that, but to ensure that the folks coming up are representative of our community. And so we identify, and one of the things that county was able to do is to provide resources to ensure that those people have access to training. So we regularly, when we have the funding available, we'll come to the coalition, and sometimes we'll talk with Rick or other folks to identify individuals. Other times we just put the broad network out that, you know, we could probably assist in funding 3 or 4 people to attend a national level training on the mainland. You know, bring somebody to CADCA or the National Prevention Network or something that would be relevant to their development and raising their capacity, to make sure we're representative. So some of that includes, how do we make sure our remote parts of our island and county, even the other islands, are represented, right? They have less resources. They don't have a coalition on their island. It's already hard to get them to come over. Zoom helps with things, but sometimes it's not good enough. And even internet connections are difficult in some of those islands. So how do we ensure that those pockets of our population and community are represented and addressed and have a say in what's going on? And we make sure that happens, and then we provide the funding to kind of back that up. Connections, like Rick said, connections to youth, parents, and through our network of engagement. Cultural groups. This is in some ways, it's a little easier when I was with the Immigrant Services Program, where I work consistently with groups like that. But Hawaii is a very diverse population, and it's always constantly changing. And that has to do with when Rick was talking about unintended consequences. I mean, it takes what, 5 minutes or less to go from Oprah's house to local communities who grew up here through the agriculture industry and the sugar canes. So, I mean, we live right on top of each other in a lot of ways. And we have a huge thing. Some of these rich families that move in the multi-million-dollar houses, a couple $100 fine is nothing to them, but a couple $100 fine is huge to some of our other communities. And so how do you navigate such diversity? Takes quite a bit of conversation and purposeful action. And, you know, government provides a lot of these safety nets and has a different sense of understanding as to what goes on within these. And to be able to engage in those conversations with people intimately involved provides an opportunity for the coalition to gain insight. And that was an important element that we were able to bring. Feedback on policy language. Yeah, that was probably a big one. Sorry, Rick.
No, go ahead. Sorry, I thought you're done.
Yeah, no, Paul.
Sorry about that, Curtis. Didn't mean to mess you up there. Sorry, folks. It's a tricky thing about one person managing the PowerPoint. We were almost spotless there for a minute. Sorry, I messed you up. All right, so kind of the last principle here, sustainability. Again, we want this to run throughout our strategic prevention framework process. And some of those processes, those key pieces we want to make sure we're doing is we want to engage our community. We want to engage volunteers and partners in a meaningful way. Hopefully you've seen that kind of exemplified in some of the examples we gave here with how Curtis as a government sector partner has been involved. That's going to build ownership of the community. If it's staff driven, you're going to have a hard time building sustainability because the community's not going to own it. So now that Curtis really owns this coalition along with other folks, and you want to be building that from the beginning, he feels like it's meaningful, he's got a meaningful role, it's going to be much more likely that it's going to sustain its effort. We want to build a credible process. That credible process is the strategic prevention framework. So we want to be able to show our community that we have a process in place that's evidence-based, that we're not simply picking things out of thin air and going for it, that we have a process by which we determine what our priorities are and the strategies we pick to reduce those issues that are occurring in our community. We want to be relevant to our community. So we want to be identifying ways in which our coalition is really addressing what is relevant in our current community. And so that means partnerships that are sometimes outside of substance use. It means thinking about the broader implications that substance use has along with other things in our community, along with other issues in our community. So if housing is an issue in our community, like Curtis brought up, how are we being relevant to the housing issue and tying in the problem with substance use in our community? And then, of course, creating a sustainability plan is another process by which we want to ensure that we have a plan in place. We're not simply leaving our change to chance, that we are thinking strategically about how we're going to sustain our efforts. Some of the keys that key elements in our social host campaign and in our process of implementing that was certainly engaging volunteers. A little bit redundant here. We did build a sustainability plan. We tried to ensure we were relevant to what was happening. So a good example of that is COVID happens. And then what we realized is that drinking rates are going up during COVID. So we tried to tie things that were happening and relevant to how a social host ordinance was still relevant in our community, that young people are now home, oftentimes unsupervised, that drinking rates generally are going up. There's more alcohol in our community. We need this social host ordinance more than ever, maybe, right? So, tying that back, and we did, in the process of the last 3 years, we also developed a sustainability plan to help us look further out than just this campaign. How are we going to sustain our efforts over time?
Yeah, and I think one of the things with sustainability, and those of you that have been involved in have done the SAPS program, the training with SAPS, is there's a couple different ways to look at sustainability. Some of it is a much longer reach, right? Some of it is the program you're on and how do you do. And a lot of times we think sustainability is just funding. Can we continue to get funded for this? And that'll keep us running. But sustainability has a much bigger impact on things. Oh yeah, thanks, Rick. Substance abuse prevention skills training, right? So, so how does sustainability, and it's when we were the government sector, and this one was a little bit kind of both elements to it. So one was with the social host and the coalition. So the evaluation component to the law, how is that going to be assessed as it goes? We changed practices within the government division, right, to ensure community level prevention is included in the prevention system. So one of the things we did was we consolidated. So our county doesn't have a specific health department or a specific division that watches after health or substance abuse or anything like that. It falls under the human concerns department, and majority of those health issues end up with us at grants management because we fund those through our community partners. So we consolidated them and put one person in charge in that. And then that person is now involved in the coalition, right? So that there's connections between the coalition and the community work that's going on at that level, how the county funds, and to ensure that knowledge is involved. So like Rick and I do SAPS trainings together on Maui. We're both trainers for that, that training program. But this last round, because it was virtual, you need somebody. So we brought in that program specialist to assist to build more capacity at the county to ensure that there's, because like it's kind of that question, right? If Rick and I get hit by a bus, who carries the government stuff forward? And we need somebody who's in that position. So Kayla's been getting involved in that, but also consolidating so that what she learns, she can then implement in all of our prevention programming. Leveraging local funds to support coalition activities. One of the things the coalition identified is they want to do more to develop the youth component, and they were able to write in. And we had a conversation even before that, but there's a relationship. So I don't make the final decision on who gets funded and things like that. But as we do with any of our community organizations, we can provide feedback on the application process. And, we try to make sure that we stay, we're not treating one group better or different than we treat the other groups, but still, that ability to have a relationship is also helpful. Our recommendation was that we continue to fund in other ways the coalition. Dedicated staff to increase prevention services. I spoke about that a little bit, and we provide free meeting space. Once we get back to meeting in person, we're really hoping that happens at some point, that so that we can share food. Food's always good, man. I don't know. You guys will, if you've been to Hawaii, you know what malasadas are and spam musubi. This is a real thing, and it does make things better. We can provide space for those things, and we continue to provide space for that as we move forward. Even if I'm not in the meeting, we'll support that however we can. opportunities for leadership to show support through proclamations and media pieces.
All right, great. Thanks, Curtis. All right, we are rounding out here kind of the end of our presentation, and then we'll go into some Q&A. But do you want to take this, Curtis, or you want me to take it?
Sure. So Rick and I were kind of just brainstorming, and actually I even brought in some of the other staff as to what's the benefit, what are some of the tips for engaging local government? I think a key one is to really understand your government structure. We have a county council and a mayor, and the mayor has an authority to sign off on policy that's made, right? So and then it can go back and all that. You need to understand that system. Other counties are going to be different, where the mayor is much more of a I don't know, ceremonial, or it's run by a county director who is responsible to the council. So you really got to understand, how does the department structure work so that you know how to navigate that. Know who is important and what is important to them. Because sometimes you can still get the same message, but you might have to put a little bit, you might have to bring it in a different door to get to where you need to be. But also you have to understand that you don't want to cross anybody. And we'll talk about that a little bit later too. But if you bring things in that are contrary to what's important to them and they see it as an opposition, you're going to have a little bit of a harder time having that conversation. So who is important and what is important to them? One of our council members, we wanted to bring it through his department and this and that and talking, but we're like, if we can't get people from his district to sign off on it or to come and testify on it, he's just simply not going to support it. And we really struggled with gaining access and getting somebody from that place on board. And we knew that was important to him. We knew we couldn't get that, so we didn't approach that area. We knew what was important to him. We didn't have that. We found another avenue to go through to get it there. Build relationships with permanent staff. You need the policymakers, you need the directors, you need the appointed people. Eventually, they're the ones that hold the authority. But if you can get punch in, punch out, permanent staff that's not moving, see themselves as in that comfortable county role or government position, then they will continue, and you have them on board, they'll continue to advocate as administrations change or as policymakers change through elections or whatever comes. Take the advice given. Sometimes you're sitting there and you're listening, how do we approach this? And then they say, you need to kind of do this first. Do that first. The person's telling you, right? Our director told coalition members, do these things first for a purpose. We did run into a place at one point where the coalition thought they did these things right. And then the next time with a different coalition on a different topic, tried to bring in an idea. They didn't take the same advice. And then they kind of ran into a little bit of a hiccup. And then my director's calling me, who are these people and what are they asking? And then I'm calling that person, what did you do to piss off my director? And then, okay, this is what you meant. And we'll try to figure out a way to smooth it over. But they didn't follow the process, and it kind of put them in a tough spot. Have integrity. Unfortunately, there's an eroding trust in government officials in our community. And sometimes we feel that integrity, their perception may be that they may not. I have a underlying, benefit of the doubt that I think most policymakers try to get into it for the right reason. And regardless of where they sit with things, if we operate with integrity and we operate with honesty and forthrightness, then it shows through with our policy that works, because they know that we are trustworthy in what we do and that we're not out for alternative reasons. So I think having integrity, following through on your commitments, being responsible, it's only builds good options. It only builds good, I don't know what the right word for it is. It's like good karma, right? You have a reputation of being responsible, of being to having integrity and being honest. And that holds a lot of value, I think, in relationships with people. Find and cultivate champions who will leverage their power to influence others. And this is big in the government, right? If you can get somebody with power, somebody with authority, somebody who has clout, to be able to weigh in on topics, then it only helps you bring your agenda to the table, and it only helps that agenda get through things as well. There's a couple things that, I don't know, we kind of said, what are some things to try to avoid maybe? And I think one is don't assume support or assume that your coalition, the initiative is a priority to people. You really got to put in the time. When you come to the vote and it comes there, you want to make sure before it even gets on the floor that you got enough people to pass it, right? So we have a council of 9. You got to make sure 5 of them, at least 5 of them, are going to stick to it when it comes to vote, because you don't know who's going to walk in and testify against it, right? And you want to make sure that there's enough people at that table who have the rights to the floor who can back it up. And then if they have supported you in one thing, they may not necessarily support you in another. So you really want to make sure you continue to put in that work with folks. Use the systems that's in place. It's always, and understand that system. So in ours, if people are going to approach the director, it's probably a good idea to at least run it through someone in our office so that we know what's going on. Because eventually the director is going to come down and ask me what's going on with this. And if I know, then they know. So use that system that's in place. Stay on the good side of the funder. You don't like piss off your funder. So if you do get county or local funding or state funding, and sometimes it's not the easiest process, expect delays. That's part of it. Nobody's in charge. Rick's will always call, where's the contract for? I don't know, man. It's with corporation counsel. Oh, it's stuck at finance. Oh, it's with this person. Oh, so-and-so's holding it up at purchasing. And, even though as much as I try to keep things moving, it's not me, or it's not my fault. It's not my responsibility. And other people at the government, if they don't really know you and stuff too, it's a stack of paper. I don't know if you can see behind me, but I might have moved my stack of paper so I don't look so bad, but that's just the way it works. So you really gotta expect those things to kind of happen. And if you stay on the good side of them, right, then they're not gonna put you at the bottom. There's always that thing, right? Oh, you pissed me off. Well, you're now at the bottom of the pile, right? Or we're no longer going to support you, or because you're causing us more headache than it's worth. So let's just stay on the good side of your funder. That's always, sometimes their request may not necessarily make sense. And then the final one is don't talk stink about people. It's things get around, especially in the government, and things last. It's really hard to, in our office, it's hard to unpiss somebody off, right? So if you make somebody mad, it's hard to unmake them mad about you. So, and you don't know who's talking to who. So you may, in politics, there's all kinds of things going on, and it's just best to stay out of it. So you don't put yourself forward in a way that then later you might run into a problem because so-and-so talked to so-and-so. And that might be something that's very local to Maui or very local to Hawaii. But I really think that especially at the local government level, people talk and people know, in small town especially, but even in bigger, I'm sure in bigger urban ones like on Oahu, right? Oahu's a large city and it's the same. People know and things get around. So you just don't want to put yourself on the bad side of anybody. Stay positive, work with them with integrity and respect, and that goes a long ways. I think maybe now we could talk just a little bit of advice. How do you find government folks if you don't already have an in with the government, right? So Rick and I have a long lasting, involvement. And if I go back, the relationship started even before me. But I think one thing to really look at is sit down with the people, and you got to find a nexus with where your coalition runs into your local government. So it could start off as a department. You have a Department of Health, or you have people who fund local programming, or you have, an element on another one of our counties. They have it's through the mayor's office. There's a position that's about life's choices, and they do, through the mayor's initiatives to try to address substance abuse. So you have to find someone or somehow, and then where there's a nexus with the government, where it interferes or where it crosses with their work, not interferes, but intersects with their work. And then you got to find people who have access to that. it may be a cold call if it has to start off that way with the brief meeting, and then you got to really work through this advocacy and these one-on-ones and meeting with people. Find valuable reasons to come and talk to them about it. Ask them for assistance on things. This is what we're doing as a community. It would be very helpful if the government, if your department, if the mayor's office was to assist with this thing. And that's part of that. Ask them to come to a task and not just a meeting. You're going to get quicker buy-in. Once you kind of get in somehow, and it may not be you or maybe somebody else on your coalition who has a relationship. Oh, so-and-so used to work for the school and I'm part of the school. And then they go that, oh, so-and-so goes to the church with me, or we're part of the same religious community and I know them. Maybe I can have a conversation with them. Once you kind of get in, then you really kind of got to find your champions in the government. And you may, if you're not getting through with one, see if you can find ways to engage other elements to it. So maybe it goes the other way, right? You start with law enforcement and they bring you into the civil government side to things. So there could be a different ways, but you really got to find that nexus and then access, right? Where does it intersect and who has the ability to get you to that place, right?
Thanks, Curtis. And add one thing to that, and that is somebody said, what if you don't have anything going on? Just leave it at that. Loved this conversation we had. I'd love to follow up with you when we're getting going on our initiative. I want to do a quick time check, and that is we're about 2 minutes over. I just want to leave you with a couple of things. We'll stay on for a few more minutes if folks have any more questions. If you'd like to continue this conversation or you have additional questions, please feel free to follow up with Coalition Development Support. I forgot in the intro to mention that. So I work as a Coalition Development Support consultant with CADCA. CADCA gives me hours and also has staff on board to answer these kind of questions. I put a scheduling app in the chat box as well if you'd like to schedule some time to further talk about this. There's our email as well. You can email training@cadca.com. Please fill out the evaluation form that's in the chat box. That's going to get you your continuing education credits. And it was really helpful for Curtis and I to see those and for CADCA to see those. Here's some resources. If you want to do more around strategic prevention framework, if you're new to that and you want to know more about it, I'm going to stick these. I know the slide has the link there, but I'm going to stick them in the chat box. These are resources that CADCA has on each of those steps of the strategic prevention framework, as well as SAMHSA's template on that. I will also stick the milestones assessment in there. It's a way for your coalition to assess where you're at in the strategic prevention framework and where you could build your capacity. So at that, we thank you so much for being here. If you've got any additional questions, we'll stay on for another couple of minutes and hope you enjoyed it and have a great rest of your day. And Brittany, I'll turn it over to you for any final remarks.
Thank you, Rick and Curtis. This was so helpful, I'm sure, to so many people. And I saw some great comments in the chat box. So thank you again. We look forward to seeing you all at a future webinar Wednesday. We'll be coming with information in April. I believe Colbert Prosper will be doing our April 1, but don't quote me on that just yet. But if you have any additional questions, please feel free to put them in the chat box or the Q&A box now for Rick and Curtis. Otherwise, we look forward to seeing you at another webinar Wednesday. Please complete that evaluation link.